Hi, for this week's assignment, it is physician SBAR, and I chose the scenario of a NICU. And it is baby Z is 3 weeks old, infant in NICU, nursery 2. He was at 27 weeks gestation when delivered. He has been progressing well after a short period of CPAP and remains in a 24% flow support. He is receiving continuous tube feedings. He has demonstrated a steady weight increase for the first time today. He has had a couple of episodes of apnea. And when Sue the evening nurse, came in and did her assessment, she noted he was tachypneic with a respiratory rate of 75. As she was documenting her assessment, baby Z had a bradycardia episode and his oxygen saturation decreased to 75. His heart rate returned to 130 with stimulation, and Sue increased the oxygen to 28%. He also had some regurgitation of formula. His muscle tone is diminished and his coloring is mottled. She listed to his breath sounds and noted that they were equal and clear. His abdomen is soft and not distended. The day nurse reported that he had slept a lot today and his mother felt he wasn't as alert as usual. So my thoughts on this clinical scenario is that this baby is obviously having some issues with breathing, especially being at this point he is 30 weeks old. So his lungs are not fully developed at this point for him to be breathing without it. And he's already had prior CPAP issues. So I'll go through the SBAR and then give my recommendations on what I think should happen, which I believe that his oxygen does need to be increased, and probably needs to stay increased to keep him supported until the next time. And other things that are pertinent to this is that his respiratory rate was at 75, and his his heart rate did return to 130 with stimulation. So maybe there is something going on there as well. And then him regurgitating formula is also an indicator that something else is wrong as well. Ring, ring.
Hello, Dr. Wargo's office.
Hey, Dr. Wargo. This is Caitlin from the NICU at Children's Hospital. I'm calling about baby Z in nursery 2. The problem I'm calling about is episodes of apnea. Upon assessment, he had a bradycardic episode with oxygen saturation of 75 and tachypnea with a respiratory rate of 75.
What's his background?
He was 27 weeks gestation when delivered on June 27, 2021. Currently 3 weeks of age, baby Z had a previous short period of CPAP and remains on 24% flow support. His weight has steadily increased with receiving continuous tube feeding. With stimulation, his heart did return to 130. Oxygen was increased to 28%.
What's your assessment?
Respiratory 75, oxygen 75, pulse 120, on oxygen set at 78%. Breath sounds are equal and clear. Skin's mottled. Rhythm changes none. Mental status no applied here. Sleeping and alert. He's very sleepy. Pain there's none, and wounds there's none. His mother does state that he is not as alert as usual. He has had some regurgitation. His abdomen is soft but not distended. The pending labs right now are the ABG and the CBC. Would you like to increase oxygen to 90%?
Yes.
Would you like to come see the patient at this time?
Yes.
How often do you want to do vitals?
Every 2 hours.
And if the patient does not improve, when do you want us to call you again?
2 hours.
Okay, Dr. Wargo, thank you. In conclusion, I think that this clinical scenario helped me better understand how to create and deliver an SBAR, since this is the first time that we've gone through it. It is helpful to go step by step and understand the process a lot better. And I know that this one's to a physician, so there is a different process or different things that you would state to a nurse rather than a physician, or vice versa. As it has come to be known, we'll be utilizing this throughout our nursing career to do a hands-off. The scenario I did choose didn't have enough information to do a full assessment, I think, for an SBAR. There was a lot of things that we kind of had to make up, but I do think that it still gave me a good foundation to build on to better understand the whole process of doing it. So once with next course being fundamentals, being able to actually know what the breath sounds are or what the heart rate should be should also help me out to know what type of an assessment should be done or recommendation. I believe recommendation portion is one of the best sections of it, because it's what you've observed and what you want to put in or what you think the treatment plan should be. So this is helpful not only to the physician but also to the nursing staff, because obviously collecting all the data through a full shift is going to give you a better assessment to what should be the next thing, and it's just waiting on the labs or anything else in my case that come about. I think that the SBAR is critical to giving a full assessment, so that's something that I look forward to in the future, of understanding and being able to do all of it rather than just be able to set it up and piece it together. It gives a detailed account on a patient's history, vitals, and upcoming treatment plan. And I think this is very essential to have everything all together in one place and giving a full evaluation of what happened on the shift to move forward for the care for that patient. And the more information you give, obviously, it's going to be more effective to their treatment. Thoroughly given an account of how the patient looks and aware is also another thing that needs to be done, because the labs and stuff are only going to give you so much information, but being able to assess and see if the patient they progressively gotten worse or they have progressively gotten better throughout your shift, the only person that's going to know that is truly you. So giving that information to the next nurse is going to help her better take care of that patient too. I do think that the situation that I had was presented to the physician clear. Obviously, with the information I had, I can only do so much and with the fundamentals, but I think that I was able to get my point across to him and tell him all the things that were in the scenario in an order that he can flow and understand what needs to be done and what is upcoming, rather than just what has already been accomplished. So I do think that this is a great tool to use, and I am very organized, so I like the fact that it keeps you organized and it gives you a lot of detail.